To prepare for discharge, when we were in the hospital, they started letting me do all the things that the nurse were doing. And of course I was supervised by the nurse. And we got training actually by a nurse, mom and dad. We got our like a special training when all the procedure, they tell us where to order the medicine in case of something happens, where to go. And after we were trained, we have to do it with Alexandra in front of the nurse.
To get prepared for discharge, the team was really good about teaching us, everyone from the liver team to our nurses, our day nurses, were teaching us all the time. So I could list all of her medications, what dose, when she needed to take them. We knew what it would be to take care of the PICC line and the bile catheter. Everyone was really good. We knew what to feed her and when, and I like to write things down, so I went home with a notebook full of instructions, and we had done so much care in the hospital with people looking in and just saying, good job, that when we got home it was a little scary, but we felt pretty confident that we knew what we were doing.
This video was created to guide you in the care of your child's incision and bile catheter after transplant and for discharge home. Please clean the incision daily with soap and water. No special soap is needed. Healing takes about 6 to 8 weeks. The incision should not go underwater until it is fully healed, so your child should not swim during this time. Children may sit in low-level baths as long as the water line is below their hip and they can sit up while bathing. If your child is old enough to shower, please have them stand with their back towards the water while they wash up. Before they are ready to get out, they can gently wash the incision with soap and water, then turn towards the water to rinse the soap off. Immediately after your child's transplant, it is normal for the incision to have some mild bruising or redness near the wound edges, and there may be a scab formed over the top. If Dermabond, a form of skin glue, is used, you will notice a thin purplish layer over the top of the wound, which will eventually peel off and can be trimmed as it lifts from the skin. It is not unusual for the incision to be itchy at times. We recommend your child avoid scratching the incision to prevent infection. Cool compresses, or if necessary, medications can be prescribed to help with severe itching. Over the next few weeks, the bruising will disappear and the scab will fall off naturally. In 6 to 8 weeks, you will notice a thin pink line once it is fully healed. If the skin around the incision becomes red or swollen, or if the incision starts to have yellow or green discharge, please notify your coordinator, as these may be signs of infection.
The incision looks amazing. They used the surgical glue to glue the incision, and it has faded so much. It's really like a hairline scar. I mean, it's large. It's the big V across his abdomen, but it's really faint.
Before, it used to be a trademark for his and show everybody his scar. Now it doesn't bother him at all.
The bile catheter allows us to watch the bile made by your child's new liver. It also keeps the bile duct open after transplant. It's very important that the bile catheter remains in place to keep the duct from closing down or blocking the flow of bile. We understand this may be challenging with an active child and hope the following information will be helpful to you. When your child is ready to go home, the bile bag may still be attached to the bile catheter. To prevent pulling of the catheter, we recommend you take the following steps. Keep it out of reach of busy hands. Keep a onesie, t-shirt, or gown on at all times to cover the area. Do not allow it to hang when your child is being held. If they are crawling or walking, please clip it to their clothing or attach to the back of their diaper. Please empty the bag every 8 hours or sooner if it looks full. Here are the steps to empty the bile bag. First, remove the cap on the end of the bag. Then drain the bile into a cup, replace the cap, and pour the bile into the toilet and flush. Please call your coordinator if you notice that there is no bile in the bag after 8 hours. Bile is usually thick in consistency and looks dark yellow to brown in color. Please call your coordinator if the bile looks watery or if it's black in color. The bile catheter will be clamped, which is removing the bag and clamping the end of the tube, about 1 to 2 weeks after surgery. This will be done in the hospital or in the clinic. The catheter should stay in place usually for 3 months. To prevent accidental pulling or movement of the catheter, tape is used to secure both sides of the catheter in a T formation. We will place the catheter in a dressing using a 4-inch by 4-inch piece of gauze and tape it to your child's tummy as shown here. When you are at home, we recommend changing the dressing every 3 to 5 days or sooner if the dressing gets wet or dirty. Here are the steps for caring for your child's bile catheter. Have a helper assist you with keeping your child's hands away from the area before you remove the dressing. This will prevent accidental pulling of the catheter. Remove the dressing. You do not need to remove the tape around the bile catheter. This will be done every 1 to 2 weeks during your clinic appointment. With a Q-tip applicator, clean around the catheter insertion point with a small amount of soapy water. Gently dry the area. Coil the tubing into a circle and place it inside a folded 4x4 piece of gauze. Then secure to your child's tummy with tape, preferably above the diaper or underpant line to prevent it getting dirty. If the catheter is pulled out of place or accidentally removed, please call your coordinator. Depending on how long it has been in place, we may want you to come in for an X-ray to make sure the catheter is still in the correct position. We may also give your child antibiotics to prevent infection. When it is time to remove the bile catheter, we will remove it during a clinic visit. There will be little to no pain for your child. Your child will be given antibiotics before and after the procedure to prevent infection. As always, if you have any questions about the care of your child's incision or bile catheter, please do not hesitate to contact a member of the transplant team.
Emptying the bag wasn't really a problem for me. It was a pretty simple twist connection. I had made a little pouch for it because I was into sewing at the time, and so I had the pouch tied to my jeans to conceal it a little bit. And whenever I felt a little weight in it or, I went to use the bathroom, I just gave it a little dump.
Taking care of Clara with the bile bag for us wasn't as difficult as I expected. She had her biliary catheter in for almost 3 months post-transplant. They did clamp it and take the bag off about 3, maybe a month afterwards. But while she had the bag, it wasn't collecting a lot at that point because her liver was doing such a good job. So we kept it really taped, made sure she stayed clean, and then we'd roll the bag up into a big tube and I'd Ziploc it, or Velcro it into her diaper, and then put a onesie on her so it couldn't escape. She couldn't pull on it because while we were in the hospital, she thought that was the best toy because it was right there and it was juicy, and so we had a little teddy bear that sat on top of it, and it was her bile buddy, and it just kept it out of sight, out of mind. Once we got home, we tucked it away as best we could, and once the bag was taken off, we just rolled it up and taped it right to her belly, so she had a big patch, but she couldn't get to it. I didn't have to worry about it, and then I learned how to clean it and take all the dressings off and rub it down and redress it, so it was nice not to have to worry about going in, and I knew it wasn't going to come out. To get prepared for discharge, the team was really good about teaching us. Everyone from the liver team to our nurses, our day nurses, were teaching us all the time. So I could list all of her medications, what dose, when she needed to take them. We knew what it would be to take care of the PICC line and the bile catheter. Everyone was really good. We knew what to feed her and when, and I like to write things down, so I went home with a notebook full of instructions, and we had done so much care in the hospital with people looking in and just saying, good job, that when we got home it was a little scary, but we felt pretty confident that we knew what we were doing.
Once your child is ready for discharge from the hospital, your transplant coordinator will meet with you to go over the information in your discharge binder. The information in the binder will be a helpful resource for you when you are home. Please keep the binder in a place you can easily get to it at home and bring it with you when you come for clinic visits. The following topics are written in detail in your binder and will also be discussed at the time of discharge. Labs. After discharge from the hospital, your child will have labs checked every Monday and Thursday morning between 7:30 and 8 a.m. As your child gets farther out from transplant and is stable, the schedule for labs will be stretched out to weekly, every 2 weeks, and then monthly. There is a list in your discharge binder of the blood tests that will be run when the labs are drawn, as well as a range for normal values. Lab results will be reviewed by your doctor and coordinator. The results will be discussed with you either over the phone or at your next clinic appointment. If your child has a central line, labs will be drawn in the short stay unit or SSU on the first floor of the hospital. You will be given a schedule with your child's appointment time. Please check in at admitting registration where lab stickers will be printed and given to you. Then go to the SSU where a nurse will draw labs from your child's central line. If your child does not have a central line, the labs can be drawn at the hospital or the clinic outpatient lab. Your discharge binder lists the locations. The lab should have a copy of your child's orders, but it is good to have a copy or the lab orders with you also. Before discharge and at clinic visits, we will make sure you have extra lab slips to keep in your discharge binder.
Understanding my lab results was a daunting task at first. There's lots of letter codes and number codes that, the first time I saw a result sheet just kind of sent my head spinning. But again, asking the team questions about, what tests we're doing what, and looking online and keeping, I keep a binder of all my results. So nowadays I've gotten a feel for what's normal and what's abnormal for me, and I can just, I see tests come in and I kind of check them to what it's been the last few times, and make sure that I know they're normal.
Please bring your child's dose of Prograf with you to the lab draw and always give the Prograf after the blood is drawn. It's not unusual to find a line of patients ahead of you when you arrive to the lab. Your child's Prograf dose may be late on lab days, and that is okay. Clinic. Clinic is held every Monday and Thursday from 1 to 4 p.m. We hold clinic in the afternoons so that the lab results will be ready at the time of the visit. This is the time when your child is seen by the doctor and his or her coordinator. The social worker and nutritionist are also available in clinic if there are any questions or issues that require their attention. The surgical team is not a part of this clinic, but is available if surgical issues arise. The doctor will ask questions about how your child is doing out of the hospital, perform a physical exam, and review labs from that morning. If changes in medications are needed, they will be discussed at clinic and you will be given a new medication list. Please bring your binder to clinic and any medication bottles you have questions about. If your child has lab results that are not in the normal range, or if there's any concern about a complication from a transplant or signs of a possible infection, we will make a plan of care at the clinic. This may include repeating labs, getting an ultrasound or x-ray, possibly a liver biopsy if there is a concern for rejection, or even a readmission to the hospital. How to get a hold of the team. We understand that it can be scary and overwhelming when you leave the hospital for the first time after transplant. Rest assured that the transplant team is available to talk with you any time of day or night. During the weekday business hours, you can call the transplant office to speak with your coordinator. At night or on the weekends, the pediatric GI fellow is on call to answer your questions or concerns. Please refer to your discharge binder for the phone numbers.
Getting in touch with the team we found it to be quite easy. During the day it's great. Our transplant coordinator is always available and she's quick to respond to emails or phone calls, and if she's not there, someone else steps in. We've been fortunate to not have to get in touch too much after hours. She was hospitalized a few months after transplant with a really bad fever, and I called the on-call liver people and they got right back to me, and we did a couple of phone calls to figure out what we needed to do. They made a plan. We were admitted, and it was all very simple and a lot easier than I ever expected, because that was one of my big fears once we were discharged is, well, what if we need help? Who's going to help us? And there's always someone.
When to call. Depending on how severe the symptoms, please call your transplant team, pediatrician, or 911 if your child has any of the following: a fever over 101 degrees Fahrenheit or 38.5 degrees Celsius, a change in breathing pattern or worry for difficulty breathing such as grunting or panting, eating less than usual, urinating or peeing less than usual. For infants, this means less wet diapers, diarrhea, vomiting, changes in your child's behavior, like seeing that your child is extremely tired, pain that is not improved with pain medication, or if your child is inconsolable. Please call the transplant team if you notice any of the following: redness, swelling, tenderness, or discharge at the incision, which can be a sign of possible infection to your child's wound. If the bile bag is not showing signs of bile after 8 hours, or if the bile appears watery or black in color, please call your team. Medications. Before you leave the hospital, you will be taught your child's medications by your bedside nurse, coordinator, and transplant pharmacist. Just after transplant, most children have quite a long list of medications they need to take. After the first few months of recovery, the medications will be discontinued, and eventually your child may just need 1 to 3 medications every day. A medication list can be found in your discharge binder. Since we update this list at every clinic visit, this list is always the most up-to-date information about your child's medication. Doses of your child's medications change frequently during your first few months after transplant, so please use the medication list for current doses instead of what's on the prescription bottle. If you are ever confused or have questions about the medications, please call your coordinator. One of the most important medications is the immunosuppressant called Prograf. It keeps the body from rejecting the new liver. You must remember that your child can neither eat nor drink within an hour before and an hour after the Prograf dose. This means no eating or drinking in the hour before the Prograf dose is due or an hour afterwards. Prograf is given once in the morning and then 12 hours later in the evening. It is very important to pay attention to how much medication you have at home and have a plan for refilling so that you never run out of your child's medications. It may take time for insurance authorization and for your pharmacy to prepare the medications. Always contact your pharmacy about a week before you need a refill. We can help you find a pharmacy that is convenient for you. Often, we can find a mail order pharmacy that will deliver medications directly to your home.
To prepare for discharge, when we were in the hospital, they started letting me do all the things that the nurse were doing. And of course, I was supervised by the nurse. And we got training actually by a nurse, mom and dad. We got our like a special training. When all the procedure, they tell us where to order the medicine in case of something happens, where to go. And after we were trained, we have to do it with Alexandra in front of the nurse.
General restrictions. The risk of your child getting an infection is greatest right after the transplant due to the amount of immunosuppressant medications your child has received in the hospital and is currently taking. There are some things you can do to lower your child's risk of getting an infection. Good hand washing is the best way to avoid infection. While there may be many family members and friends who want to see your child after transplant, please make sure all visitors are healthy and practice good hand washing.
So one of the ways that we teach try to teach him how to stay healthy and just take care of normal hygiene is about washing hands. And, you know, teaching him the song, Twinkle, Twinkle, Little Star, How I Wonder What You Are. And, you know, making sure that as he's washing his hands, he uses soap, and that he's singing the song, and he has to sing it all the way through while he's, you know, washing his hands. And so that gives him knowledge of how long to do that. And making sure it's a consistent practice every time he uses the restroom, before he eats, and then also even before he eats, if he can't go to the restroom to wash his hand, is to make sure he has some hand sanitizer. And so we'll actually pack a little hand sanitizer in his bag, or the wipes, the hand sanitizer wipes, and a lot of classrooms have that in their classrooms now.
In the time right after transplant, we encourage you to stay away from indoor public spaces such as malls, crowded movie theaters, buses, subways, and elevators. We encourage your child to return to school and other activities as soon as possible after transplant. Return to school or daycare will be determined by how well your child is doing and the amount of immunosuppression they are taking. We do not have specific activity restrictions for infants and toddlers. Their bodies tell them what is okay to do. If not uncomfortable for your child, they may sleep on their side or tummy. For older children, we recommend no heavy lifting or rough activities for the first 6 weeks after transplant. We recommend no swimming, hot tubs, saunas, or submerging baths until the incision is completely healed with only a thin white or pink line present and the bile catheter is removed. Immunizations. About 3 months after transplant, your child can return to their pediatrician and get caught up on the non-live vaccines. We encourage annual flu shots, but recommend avoiding the nasal mist variation, as this is considered a live vaccine. Some vaccines contain live viruses, such as measles, mumps, rubella, varicella, and rotavirus, and can cause an infection in transplant patients if they are received after transplant. We recommend your child avoid these and any other live vaccines after transplant. A list of approved vaccines and ones to avoid is in the discharge binder and will be discussed with you by your coordinator. If your child is exposed to or breaks out with chickenpox, please call us immediately.
Making sure that he gets all his necessary vaccinations, right, in terms of his flu shots, and really partnering with your pediatrician, your regular pediatrician, to know that there's certain certain vaccinations as an immunosuppressed child they can't have, right? You know, they can't have anything dealing with live vaccines.
Your transplant team is always available to you and will help you and your child through these challenges. Dentist. We recommend your child see a dentist yearly after transplant. There are no special treatments or antibiotics needed for dental procedures. Teen issues. During your child's teen years, many things change, including their activities, time spent away from home, and other things that cause medication times to be challenging. We have created a teen clinic especially for this group of patients that includes adolescents ages 12 through 21. We dedicate this clinic to help teens and their parents problem solve the issues surrounding growing up and moving on to adulthood. We meet 4 to 6 times a year during the Monday clinic time and include our transplant social worker and transplant psychologist, along with Dr. Berquist and the coordinators. This program will become part of your transplant follow-up as long as you can travel to our transplant center. The time after transplant can be challenging, and there may be bumps in the road. Having a suppressed immune system is a balance between the risks of infection and the risks of rejection. Please know that the risk of these issues gets less and less the further out from transplant your child becomes. Your transplant team is always available to you and will help you and your child through these challenges.
I guess by the time he was maybe a year old, one of the transplant doctors said, Jennifer, you really got to take him outside of the bubble. He really needs to have normal kid experiences. But I thought when he got sick, he would be sick forever and that he would have to go to the hospital. And for the most part, the things that he's gotten from being immune suppressed have been typical child colds where he may be sick a little bit longer than another kid, but he's never had to go to the hospital for any of those kinds of things. knowing that it gets better, and it gets better pretty quickly. You go from the 8 to 12 medications down to just a couple really soon, and that was nice. And I wish I had known how quickly that transition went.
You're not in this by yourself, right? And you're really not. They're really there to help you. They want the best for your child and for you and your family, because you spend so much time as a caregiver taking care of your child. And I can't stress it enough. It's okay to take care of yourself.
Use people around you, let them help you, and let them take care of you.
I would say enjoy that everything went really good, and just being with her, knowing her in that way with new medicine, lots of medicine, but also looking forward that it was just gonna be like for a short period of time, and looking forward, and eventually like she will start getting off of those medicine and living a different life. She is really into swimming. She loves to go swimming most of the time. Like, she's taking some competitive classes right now, and dancing. That's her two strengths.
So we're a year and a bit out of transplant. She's just a really happy 2-year-old. She runs, likes the playground. The carousel is the new absolute favorite thing, which we went on 4 times yesterday. So yeah, she's a happy, healthy 2-year-old, and you'd never know anything was wrong with her.
He's wonderful now. He's happy and he's healthy. He loves rides at amusement parks. Any ride that they'll let him go on height-wise, he loves, roller coasters even.
He keeps us extremely busy because he loves to learn different things. He does martial arts, which is interesting given that he has a transplant, so we had to make sure we got permission for him to do that. But he really likes that a lot. He loves riding his bike. He's just a very active 6.5 years old.
Very recently after my transplant, people were surprised when I told them that I had had a transplant. A lot of people said, gosh, you know, I can't believe you look so healthy, or I expected you would look more sick. But really, I live a normal life other than a few meds and a few lab visits. I don't really feel held back at all, and it's amazing.